High versus low blood pressure trigger in patients with septic shock. Definition: septic shock is characterized by arterial hypertension despite adequate fluid resuscitation. The surviving septic contains recombinant terbium and mean arterial pressure of at least 65 during initial resuscitation of patients with septic shock. Applications in medicine. This campaign one recommended initial resuscitation with vasopressor to reserve hypotension, with a mean arterial pressure target of at least 16.5 mmHg.
System to supply cells with oxygen. In early stages, symptoms occur as the body attempts to compensate for blood loss. Physiological causes of shock are the heart failing to pump, loss of blood volume, or blood vessels dilating, creating a vascular container capacity that is too great to be filled by available blood. Categories of severity are compensated shock, presents as an increased heart rate, increased respiration, and constriction of peripheral circulation, which results in pale, cool skin, and in infants and children, increased capillary refill time. Decompensated shock starts with low blood volume or lack of perfusion. Symptoms include falling blood pressure. Shock is irreversible when
and overall he looked septic. CC was admitted to the ICU.
Pros and cons. Septic shock is a major risk factor for atrial fibrillation in your body. Atrial fibrillation was significantly more common in the high target group than in the low target group.
With severe sepsis. Sepsis is the presence of infection associated with a profound systemic inflammatory response. Severe sepsis means there is also evidence of organ failure. Septic shock means that the blood pressure doesn't respond to aggressive fluid therapy. This systemic inflammatory response syndrome is called SIRS and is present when at least two of the following criteria are met. Temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute, and white blood cell count greater than 12 or less than 4. Mortality with sepsis or severe sepsis is 20 to 50%. Older age, immunosuppression, poor prior functional status, infection with a resistant bug, prolonged need for blood pressure support, and progressive organ failure are associated with worse outcomes. Sepsis is a clinical diagnosis and may be associated with any kind of infection. However, the most common sources are lung, intra-abdominal, and urinary tract. In addition to aggressive resuscitation, sepsis management requires prompt initiation of appropriate empiric antibiotics, as delayed therapy has been associated with increased patient mortality. Empiric antibiotic selection should consider the following: presumed site of infection, available microbiology information, known colonization, resistance patterns, and chronic illness. Given the minimum margin for error, broad-spectrum antibiotics are warranted until culture results are available. Once a bug is identified, narrow or tailor antibiotics for the remainder of the course. There is no evidence that combination therapy is more effective than single-agent treatment. For CC, the presumed infection is severe community-acquired pneumonia and a reasonable empiric regimen is ceftriaxone plus azithromycin, and in flu season, oseltamivir can be considered. If CC has chronic obstructive lung disease with
This adverse effect might be related the higher dose and the longer duration of catecholamine infusion in the high target group. Diseases. In conclusion, among patients with septic shock, mortality did not differ significantly between those who were treated to reach a target mean arterial pressure and those who were treated to reach a target.
Altered level of consciousness, fever, and uncontrolled bowel movements. He does not speak English and his caretaker is in.
Well, get the caretaker in here. Fluid wide open.
The paramedic intern started a 18 gauge in the left forearm. The patient's vital signs are blood pressure 88/60, pulse 130, respirations 20, and a temperature of 104.5 degrees.
Go ahead and administer Tylenol Pareto Rico and get a full set of cultures. Once the first liter of fluid is in, go ahead and hang another 1000 cc's. I am going to place a central line in his left external jugular. Also, while we wait for the blood test to come back, we can start him on a broad-spectrum antibiotic. He appears to be septic.
Doctor, we are now a few hours into treatment and have administered 4 liters of normal saline. The blood pressure will not stay above 90 systolic. The patient's temperature has come down to 101.5 degrees and his pulse is now at 110. The ICU now has a bed open.
Okay, let's get him up to the ICU. Good job, team.